Javier has limited time left and is experiencing significant pain and discomfort. But Mr. Javier's family is determined to explore every possible avenue to prolong his life and alleviate his suffering. They have researched and come across an experimental drug that is currently in the early stages of testing for his type of cancer. Furthermore, they have learned that there is an ongoing clinical trial for this drug, and they are eager to have Javier participate in it. However, the medical team is cautious about the experimental drug as it is not yet approved by regulatory authorities and its potential benefits and risks are largely unknown. They also worry that participating in a clinical trial could expose Javier additional uncertainties and potential side effects with no guarantee of positive outcomes. So our questions are as follows. So how can the medical team ensure that the family fully understands the potential risks and uncertainties associated with experimental drugs and clinical trials, while also respecting their desire to explore any possible treatments for Mr. Javier's condition? Second question, what legal and regulatory factors should the medical team consider when discussing the option of experimental treatments and clinical trial participation with Javier's family? How can they ensure that any decisions made align with existing laws and guidelines? Finally, Javier's family is grappling with profound emotional distress and a strong desire to help him. How can the medical team address the family's emotional needs and provide support while also managing their expectations realistically regarding the potential outcomes of experimental treatments and clinical trial participation? So, here we are presented with the case of a patient who is grappling with cancer, whose family is very eager to enroll him in a clinical trial, clinging to that spark of hope that the trial would be able to do something, if not a miracle, for Javier. So I think I'm going to pose this question first to Father Jerry and Attorney Postol about how we can, in practical sense, how can we help the all involved, these stakeholders, Javier and his family, understand the risks and uncertainties associated with joining with a trial. Of course, it's an experiment, but yet we respect their desire to be part of a scientific and hopefully a therapeutic process. Any comment on that? May I begin with you, Father?
Yes. Well, there's not. We cannot what you call this blame Javier's family if they have to go, or even, for example, try to ask the doctors for an experimental drug. Okay, even if the experimental treatments does not give that much hope. Okay. Remember, again, I told you already, the case of baby Charlie Gard of UK, who was a mitochondrial depleting syndrome. He was a baby. But, you know, they have all the money. They want to go to the States because there is this experimental drug. Okay, there is this experimental drug with some success, but not really. Okay, but you know, okay, the courts of law intervened. No, you can go because the courts of law had already determined that it's useless for that to have the treatment. And so what happened? Baby Charlie Gard died because there was no treatment available for this mitochondrial depleting syndrome. But there is a principle in medicine and even in morality, a principle of right to try. There is such thing as right to try, no matter how experimental it is. If you're given a little chance, the no chance at all, what are you going to choose? That little chance, isn't it? If after trying that little chance that is left, and it has become futile and useless, and that's the time to say no, no more, because this treatment is in fact useless, and this treatment is experimental. There is no benefit that can be bestowed upon the patient. That's the time to say no more. But the right to try is a very strong, is a very strong order. Why not take it even for a while? Okay. Okay, you say that because of the risks, and I would rather take the risks than no risk at all, but it is your death. I'll take the risk. After all, it is due to experimental treatments that medicine advances. So if it cannot treat this or that, at least we are going to have some knowledge about advancement of medicine about this experimental treatment. And that's all.
Thank you, Father Solis.
Yeah. Thank you. I'm so sorry. Well, actually, first, because I was reading through the case vignette and I couldn't really decide if he was conscious or not. But let us say that he is definitely conscious and is able to decide for himself. Now, when we're talking about the person's decision, we always should consider based on self-determination and his general health well-being. Knowing that this is an experimental drug, I heard what Father said earlier, but knowing that this is an experimental drug, we should also consider that it might be good for him, yes, because it's experimental. We wouldn't know if it is good or not, but it can also be. I mean, there are always two sides to the treatment, but it can also be something that would be detrimental to him. I mean, it might, just like other chemotherapeutic drugs, it might save him, but it's going to make him feel worse. So, I mean, when we're talking about general well-being, yes, he may be getting better from the disease. The drug might be killing what's supposed to be killing, or it's supposed to be getting better, but his general well-being during the time that he's being treated might not be something that he wants to go through. So from that point of view, the patient should be able to decide whether he thinks this is reason enough for him to take the drug or not. I don't think this will be called passive euthanasia, because in the first place, this is already an experimental drug anyway. So from an ethical standpoint, it is really ethical for him to say yes or no. It is also very important for him to realize what he is getting into. But I do agree that if there are no patients who do agree to experimental trials, then there will be no development of new drugs.
Thank you, Dr. Valencia. I think
Can be, yeah, yes,
yeah, legal repercussions in Javier's joining the trial.
Oh yeah. Well, firstly, I just have to. I'm sorry. I have to echo that it is a very important first legal consideration to ask what Javier wants, because as we discussed earlier in the first case, legally speaking, the decision of the patient trumps whatever decision of the family is. So we have to clear with Javier what he wants, whether he even wants to try. But let us suppose he also wants to try. Is there a right to try? I do believe so. I do believe it's a basic human right to determine what it is that we want to do to our bodies, what it is that we want to try. Oftentimes, the only limitation that the law prescribes is whenever what it is that we want to do with ourselves might affect others. And if it does not injure others' rights or well-beings, then, or public safety, public health, and all that, then oftentimes it is allowed and it is respected. But we do have to remember as well, and this leads to your other question, the legal considerations, that every right is limited by the law. There are very few rights out there that are not curtailed by the law in one way or another. Some just have very little curtailment, some would have a lot. And in this case, what we have to remember is, well, even if we want to respect the patient's right to try, it does not mean as a physician that we should just go ahead and plunge the patient in a clinical trial. There are regulations that we have to follow. And firstly, that would be the Food and Drug Administration Act, the implementing rules and regulations of the Food and Drug Administration Act, which is RA 9711. The regulations, the issuances of the Food and Drug Administration in the Philippines, I would say the one that you really have to look into if you would like to participate or have your patient participate in a clinical trial would be Administrative Order 2020-0010, which prescribes the regulations on the conduct of clinical trials for investigational drugs or investigational products. And lastly, of course, our very own Code of Ethics approved by the Philippine Medical Association. Why does that matter? Even though it's a Code of Ethics, because legally speaking, according to our Medical Act of 1959, if you violate any provision of the Code of Ethics approved by the PMA, then it could have legal consequences. Particularly, it could result in the imposition of administrative liabilities, which in the worst case means you can lose your license to practice if you violate that particular code. So, to be more specific, what we have to remember as physicians when dealing with investigational drugs, investigational products, is that as a rule, generally, if they are not FDA approved yet, and apparently it's not approved by the FDA yet, no, the 𝐂𝐚𝐥 experimental, not yet approved by the FDA, the distribution, transfer, promotion, advertisement, sponsorship, the non-consumer use of those drugs are prohibited. They are considered crimes, and the penalty for that can be as much as 500,000 pesos fine and imprisonment of up to 10 years. Minimum imprisonment 1 year, minimum fine 50 years. So even in the minimum, it would hurt a lot to sponsor a drug that is not FDA registered. And if you prescribe experimental drugs that are not FDA registered, it might be construed as that, as a violation of that particular provision of the FDA Act. Additionally, of course, there would be administrative fines that might be imposed by the FDA or administrative penalties. If you're running a particular establishment, the hospital can lose its license to operate. There might be an imposed fine as well against the establishment of up to 500,000 pesos. But again, that might be the least of your concerns because these are only administrative liabilities. You might be more worried about the criminal liability. So that said, all we have to do is follow the issuances of the FDA to safely enroll our patients into these clinical trials. And I wouldn't go to the details of Administrative Order 2020-0010. I would like you to read up on it, really, if you're interested in it, but maybe just a few pointers about it, some general principles, of course. If you want to participate in a clinical trial, you need to get authorization from the FDA, either as a sponsor or as a contract research organization. You have to do that. You need to, before you commence any clinical trial, you need, again, approval from the FDA. And actually, the issuance also requires approval from the Research Ethics Committee of the institution as well. And this is echoed in our Code of Ethics. You need approval from the Research Ethics Committee or the Institutional Review Board before you go ahead and conduct clinical trials. And both the administrative order from the FDA and the Code of Ethics also require clinical trials be conducted in accordance with the ICH Good Clinical Practices guidelines. So those are the very broad requirements of the FDA to safely engage or conduct these clinical trials without legal repercussions. So, yan po.
Thank you, Attorney Kay. No? So it appears that, so far we have established the most obvious ethical questions, which are, well, of course, Javier's autonomy, and also the wishes of his family, and also potential benefits and harm of joining a trial.